Hello, my name is Joanna Rojas Enriquez, and my presentation is Type 2 Diabetes Mellitus. Patient and chronic illnesses. Ms. AR is a 53-year-old Hispanic female. She is in the middle class bracket with PPO insurance. She's been married for about 30 years with 3 older children. She's had diabetes type 2 for 20 years. And some of the medications she takes is metformin, Levemil, Trulicity, and glipizide. Clinical judgment for self-care capacity. Chronic disease self-management. She is able to meet personal needs and hygiene. She is visibly overweight, struggles to ambulate around the house, takes longer than expected to verbalize answers, and reports she forgets most of the instructions given at the clinic. Discharge planning issues. She does have issues with medication compliance, knowledge deficit, unhealthy lifestyles, forgetfulness, and poor ambulation. Some of the referrals that should be considered are diabetes education, nutritional consults, home safety inspection by PT/OT, and that's via a home health referral, evaluating for early Alzheimer's with her PCP. As part of her discharge, Ms. AR is able to discharge home with family. Since she is able to meet her own needs, she just needs further reinforcement with her diabetes compliance, and also make sure that a home health referral is in place to look at the safety of her home and make recommendations for any type of products she may need to better ambulate around her own home. Lastly, ensure that the patient does have a scheduled follow-up appointment with PCP, so they can also do the appropriate referrals upon recommendation. NCM strategy. Patient level, she does need further diabetes education, nutritional education, and healthy lifestyle education. All of these will bring proper med compliance. System level, appropriate referrals should be made to all the patient level strategies, as well as setting up short-term goals, long-term goals, and a backup plan. Patient level interventions is self-management through knowledge. According to Larson, the outcome of client empowerment is self-efficiency, mastery, and self-control, and a renewed and valued sense of self. So with diabetes education, patient will be able to gain confidence of taking control of the diabetes. Nutritional education should be making better food choices based on glucose levels. And then lastly, healthier lifestyles, which both go into diabetes and nutrition education. She'll be able to start incorporating exercise to better her, not only make her lifestyle healthier and improve her weight, but better her glucose. System level interventions. Using specific nursing interventions and planning. So understanding and respect of the social, cultural, and psychological factors that influence adherence behaviors may enhance efforts to manage the problem of non-adherence. This is according to Larson. So at a system level, it's important for the patient to be involved with the nursing interventions and planning. That way there's better outcomes. Some of the short-term goals should be easy and attainable, something that the patient can look forward to and try to make as her short-term goal. As part of the long-term goals would be measurable and motivational. For example, having an A1C of less than 6, something that can be measurable and should be motivating for the patient. And lastly, a backup plan. So backup plans, I think, are the most important because sometimes when we fail, we give up. And having a backup plan, the patient will be able to have less desire of giving up. All of these are really based on the patient, social, cultural, and psychological factors. That way, we're not just making something up, we're basing it on her and giving an easier manage and easier to intervene. Utilization review. So part of the utilization review is to adequately review all the medical records of the patient to ensure everything is set and ready for discharge, as well as collaborating with the medical team, making any more recommendations that deemed necessary prior to be sent in home. And lastly, following up with the patient and ensuring that she does understand the plan of care for discharge. Quality and safety issues. So the main goal is to ensure the transition from acute care to home is safe. So I would make sure that the patient was preliminarily evaluated by physical therapy, maybe given a cane or a walker here in the hospital, anything to help the ambulation while she gets the more appropriate screening by home health PTOT. Also make sure that the patient's medications are not only at the pharmacy, but they're being covered by her insurance, because sometimes if they're not covered, the patients aren't willing to pay for them and just not take them, and lack of communication is done. Also make sure that the patient does have a follow-up appointment with the primary care physician. And lastly, not only ensure that she has transportation to go home, but appropriate transportation to go to her initial follow-up appointment with her PCP to make sure all the referrals that are needed and all the extra evaluations that are deemed necessary are done. Effective NCM effectiveness at patient level. So more likely to keep up with her follow-up appointments as well as routine lab work and have glucose readings for the physician to assess. She also began to make small changes to help with diabetes based on all the education that's being done, the diabetes, the nutritional, and the healthier lifestyle education. And lastly, Mrs. AR will have the confidence and encouragement to make better dietary changes, increase activity level, and incorporate overall healthy lifestyle changes. At a system level, the goal is for Ms. AR to take control over her diabetes, as she will continue to gain knowledge with education, guidance, and support, resulting in decreased hospital admissions, decreased visits to her primary care visit, and maybe the need for less medication due to better compliance, saving money for not only the patient and the hospitals, but also the insurance. I would like to thank you for your time. These are my references that I use.